Hello everyone, welcome to another episode of 604 Come Up. Today we have Tim here, and he's an advanced care paramedic, and we're just going to be talking about his paramedic career. So without further ado, introduce yourself, Tim.
G'day, thanks for having me on the podcast. As you can probably tell, I'm a paramedic from Australia. I moved here about 12 months ago with my wife and two boys. And we moved across to Canada just to be a bit closer to family. But prior to that, I was a military medic in Australia, and then a paramedic, starting off as an advanced care paramedic and then critical care paramedic before we moved across. Also doing a little bit of research as well on the side, and a few other little things and bits and pieces which we'll probably talk about today. But I guess probably finish by saying thanks for having me on.
No worries,
It's awesome.
It's an honor. I was actually looking for a paramedic to have on the podcast, and I ran into you on Twitter. Shot you a DM, and you were more than happy to be here, so thank you.
Absolutely. I'm trying to showcase all the awesome work that BC Ambulances is doing here in Vancouver, so I try and get as much stuff out there as I can. Yeah.
Nice. I see that you're active on Twitter too, which is good, right?
Yeah, very active.
Is it just Twitter you're on, or Instagram?
No, it's mostly Twitter.
Twitter, okay. Good. So why a paramedic? What made you want to become a paramedic?
Well, it's a bit of a long story, but when I was much younger, I was in St John Ambulance, which I think you've got here in Canada as well.
It's in downtown, yes.
Yeah, so I was doing a whole bunch of events with them at the local football in Australia, and I just remember once we did this call, and I was 12 years old. I was a cadet. Probably shouldn't have been on the call, but I ended up on it because we were so close, and it was a gentleman who had a cardiac arrest. And I didn't do a great deal at the call. I kind of just stood there and watched and passed a few things to people when they asked. But I remember seeing these paramedics that turned up that resuscitated him. And I guess that was the day where I just thought to myself, yep, I'm going to be a paramedic. And in fact, I'm going to be a critical care paramedic. So fast forward down the road, probably about 15 to 20 years, and I finally got there. But I think that's the motivational story. I try and tell people about why I wanted to do it. And I just knew at 12, like, that's all I wanted to do. And that's all I've kind of done since then. You know
that's true motivation too. If you remember that from 12 years old, right?
Yeah,
and it stuck with you for that long.
For sure. Yeah.
That's crazy to see. Well, when you started in the paramedic field, right? I'm assuming you didn't go straight to advanced care paramedic, sorry?
No.
Because that's like the top, right?
Yeah.
So what are the rankings in when it comes to paramedics?
A little bit different from Australia to here, but if we talk more about what it's like here in BC, essentially we have varying levels of licensing within the province. You can start as a first responder, which a lot of our local firefighters do have, and they provide care a lot of the time prior to ambulance arriving. And then in terms of our paramedic workforce, we have what we call EMRs, who work out in a lot of the remote communities. Usually they're people who just live in the communities and they want to provide some support and man the local ambulance, and that's the qualification that we give them, or that they obtain, and then they're able to provide that service. And then from there we've got our PCP, so primary care paramedics, which is the large majority of our workforce, around about 3,000 or so paramedics. They're most of the paramedics that you'll encounter here in the province. And then from there, we've got advanced care paramedics, which are another level up. They operate in road ambulances, typically in built-up cities, so in Vancouver, Kamloops, Kelowna, Victoria, Prince George. And then from there, we've got another subspecialty, which is broken into two, which is our critical care paramedics. They typically fly, so you'll see them in the helicopters, and our infant transport teams, who are very similar to our critical care paramedics, but they look after mostly young kids. So they do all the neonatal transfers from other parts of the province and bring them into the city to receive that specialty care within the children's hospital here.
Okay, nice. Yeah, so CCP, right, is a critical care paramedic.
Yeah. Yep.
And then, okay, cool. And ACP is, for everyone listening, is advanced care paramedic.
Yep. So they're the highest, typically the highest qualified paramedics at a street level here in the city. So whenever someone's really unwell, typically you'll see those ambulances arrive on scene, and they've got the big writing on the side called Advanced Life Support Unit, so that you can tell them apart sometimes.
I never even knew that, so I'll keep an eye out now.
It's all the little things. All the little things sometimes people don't know, which is why we're always happy to talk about it.
Wow, so we already learned something new.
There
Only 2 minutes into
there you go, 2 minutes
into the podcast. So I know there must be a lot of schooling involved, right, to become a advanced care paramedic. Can you I know you went to school in Australia, right? So just, I guess it's kind of similar. It might be, or
it
might
is
not
a little
be.
bit.
Break it down for us.
So here in BC, to get your PCP qualification, you're looking at around about 6 months. of training at the JI Institute here in British Columbia. That's typically where most our paramedics get their training. And then when they look to move up to the advanced care paramedic level and gain that license, they go back to the JIBC and they'll do their advanced care paramedic course, and that takes about 20 months. And both those courses have a coursework component and also a component where they go out on ambulances and they're mentored or precepted by experienced paramedics as well. So that's really similar to a lot of professions out there, and so we're not too different in that regard, in that we'll bring you into the classroom, teach you as much as you need to know, and then we send you out there to kind of put it all into practice, see those patients in a facilitated environment, and kind of learn as much as you can for the day that you do come back and you're working independently and making decisions on your own.
That's good to get the hands on. So would that be counted as a training, or is there separate training that you have to do after schooling?
So once you finish schooling, you've got your license. If you're a primary care paramedic, you apply to the ambulance service and you commence employment right away. We think the training there is pretty good, so those applicants are job ready. But in terms of the advanced care paramedics, it's a little bit different, because what we know about that cohort of paramedics, there's only about 200 of them in the province, is that the types of calls that they're exposed to require a lot of complex decision making, often in time critical situations with patients that are very sick. So with that group of paramedics, once they've got their license and they've finished their education, we put them through a preceptorship as well, and that can range anywhere between 2 months to 6 months to 12 months. It just depends on how long that paramedic needs to feel comfortable operating independently. And what we do there is we throw them out onto the road, doing those high volume calls, but in a really highly supported environment, and that's how they start. And by the end of that process, what we want them to be doing is working more independently, and that's when we know they're ready to operate independently. And the reason we do that is because in that higher echelon of call volume, the buck stops with that paramedic. They're the clinical leaders. Whilst there's people that they can defer to and speak with, often they're making the decisions independently that can make a difference in a patient's outcome. So it's really important that we are comfortable that they know what they're doing. That's good that you make sure till they're fully comfortable before going out there on the field. Correct. Which makes a huge difference, right? And becoming a upcoming paramedic, that could be a big thing for you, right? Absolutely. Yeah. Some people might be shy to say that they're ready or not, but having that support with you, that can make all the difference. No, right? Absolutely. And we think we're pretty good at knowing when someone's ready, and they give us their feedback. And, for the most part, paramedics are actually very good at saying, well, look, I think I need a little bit more time, and we give them that facilitated They're straight up practice. And honest about it, right? Yeah, absolutely. Well, the bottom line is that they certainly don't want to put themselves in a situation where they weren't ready and that caused any harm to a patient. So they're really good at putting their hand up saying, look, I'm just not comfortable in this place. Can I have a little bit more time? And then we give them a bit more supportive practice and help them out there. Okay, so let's say you're done your schooling, you're done your training, you're fully out there on your own now. What are the day-to-day tasks of an ACP? Well, it's pretty interesting. I mean, the day always starts the same. The day or the night shift always start the same. So you come up the stairs at the station, you have a talk with the crew that you're taking over from, and you ask them what their day was like and have a laugh. And then you go back downstairs into the ambulance bay. You check all your equipment so that you make sure everything's ready and good to go. That's something we do every single day, regardless of whether we knew that ambulance was okay yesterday. We get into the habit of making sure that our equipment is where it needs to be, that it's charged up, that it's ready, that it's clean. And the reason why we do that is because if we just have that repetition over and over again of knowing where everything is, when we're quite stressed on a call or when there's a lot happening, we know exactly where to go into those bags to retrieve the equipment that we need, and all paramedics do that. So it's really important, and that's one of the key reasons why we check our equipment every single day, regardless of if you've been on the job 1 year or 20 years. So that's something we do to this day. And then as soon as those car checks are done and we hit log on the screen, we're into the car and we're out for our first coffee, hopefully. Maybe 6 times out of 10 we're lucky enough to get a coffee. Yeah. But every now and again we get a call straight away, and it just happens that someone's called 911 and needs an ambulance. And then from there, you really don't know what's going to happen for the rest of the day. It's really up to destiny to see where you're going to lead. So every day is different. Some days you don't do a great deal, and then other days you're absolutely exhausted by the time you get home. So it's just. How about when you're let's say you complete a call, right? Do you just patrol the streets, or do you head back to the station? Yeah, so it's a few things we can do. So we can always be out and about, and we keeping ourselves mobile, or we can go back to quarters and have a rest if we're just feeling like we need to close our eyes for a little bit, or we can go out, have a coffee, or we can meet up with other ambulance crews. The key thing is that we like to remain in our area so that we're able to respond quite quickly if a call comes in that area. So for me, I like to keep out and about, like to park up on
Stay
busy
busy.
streets. Yep, just people watch sometimes, or go out and get a coffee. And that's one of the best things about working at my station, which is 61, which is downtown on Cambie and 7th. There's just so many great coffee shops in that area. So
Besides Starbucks, right?
Look, the thing about Starbucks is that they're consistently, good, and so they're okay on the night shifts, but the day shifts were spoiled for choice. So it's good.
That's true. What's your go-to coffee place in the night shift?
The night shift is definitely Brecker. It's kind of
Brecker,
the ambulance hangout spot downtown in Brecker. But on the day shifts, mate, I mix it up. I don't like to go to the one spot. Try and change it up.
Fair enough.
Yep.
I respect that.
Yeah.
Well, when you said when you come into the station, you meet up your crew. Is it a new crew each week, each shift? Or?
No. So we operate on a platoon system, so A through to D platoon. So typically you're paired with the same partner, but there are times where your partner's away on leave and you'll be paired up with someone else. And I think paramedics are really good at interchanging all the time and being adaptable that way and just working with new personalities.
That's
so it's
good,
like
though.
any job, I guess. So.
You build up the chemistry too with your partner.
Totally. Yep. There's been a lot of bromances over the years that have, so a lot of good friends made, and
that's a good thing.
There's a lot of people that I certainly love working with. Yeah, it's a really good thing, and that's one of the things about being a paramedic anywhere in the world is that the paramedics are all the same. They're just funny people.
You can see one across the other side of the globe, right?
Yeah, absolutely. Nothing changed. It was fantastic. Actually, I really enjoyed
awesome.
seeing that when I moved here.
Well, how about the schedule? I think policing, if I'm not sure if I'm wrong or not, but it's 4 days on, 4 days off.
It is. So we work the same. So
okay.
2 day shifts, 2 night shifts, and then 4 days off. So all the shifts are 12 hours in duration, but we also have these peak period cars as well, which operate during the busier times of the day here in Vancouver, and they operate typically from mid-morning through to the early hours of the morning as well. So they're what we call a Bravo Charlie pattern. So they provide a lot of support in those busy periods. But the regular cars, what we call an alpha pattern, are 12-hour day shifts, so a 6:30 to a 6:30 day and night, and they provide 24-hour coverage. So they're the bulk of our vehicles.
You were saying 12-hour shifts, right?
Correct. Yeah, it's a long day.
Intense.
It's a long day. But when
day.
you're doing it for so long, it just becomes the new normal.
Yeah.
So I don't know what an 8-hour work day is like.
It's too easy then, right? 8 hours.
Yeah, it sounds very easy.
How were your most intense call in BC as a paramedic?
Well, I guess I certainly don't want to generalize on any specific call. I'm always mindful of protecting patient confidentiality. But in general, I think paramedics will all tell you the same thing. They all find calls with kids quite hard. And I think that's for people who have kids or people who don't have kids. I think seeing any little person that's suffering is never nice. And also as a parent, you can always see the parent suffering as well, right? So that's not something that we typically like to see. It's the calls we typically remember for all the wrong reasons. But I mean, the good thing about it is that one of the great things that paramedics are good at doing is looking after their own. So we have excellent debriefs immediately after the calls, and then we debrief a couple of days later as well. And then, if someone's really struggling with the call, they can access counselling too. And that's one of the great things about, happened in my previous system in Australia and here. It's a free service for all our paramedics. So it removes that financial barrier in accessing care and helps them.
Anyone.
Yeah, and also open to their family members too. So if a paramedic comes home after a bad call with a kid, and the whole family's struggling, then the whole family can access that care too. So I guess
with no cost, the whole family.
No cost, yeah.
That's
it's completely
awesome.
free. It's an absolutely fantastic service that's provided by the system. Yeah.
That's another thing I had no idea.
Oh, it's really good. Yeah, I think paramedics are exposed to such abnormal events on a daily basis, and some of them are absolutely tragic, right? So
sure.
we become really good at processing them, but eventually the bucket becomes full and it starts to overflow, and so sometimes we need to put our hand up and ask for a little bit of help, and paramedics are good at doing that. And so it goes a long way to helping us remain in the job for years and years to come.
How do you deal with that? Like this ongoing stress and like the mental strain, like do you have hobbies that, help you relieve of that stress?
Absolutely.
And stuff?
I typically, I do a few things to try and keep myself in check. I try to eat really healthy when I'm on shift. When I'm off shift, sometimes I slide a little, but it's okay. But when I'm on the ambulance, I have my little lunchbox packed and I always have a salad and fresh fruit, fresh vegetables, some yogurt. I just keep it really healthy on the days and the night shifts. and I limit my coffee consumption, even though it absolutely pains me. But I have my coffee in the morning, and then sometimes if it's a really busy day, I'll get another one in the afternoon. And then the other thing I really like to do is exercise. And that sounds really generic, but I think really that is the key to maintaining your mental sanity and just maintaining the energy levels to be able to come into work and deal with these sometimes really critical and tragic calls. But for all those calls as well, there are lots of good ones. But kind of keeping it in track here, I guess one of the other things I find really important in keeping myself energized and is having friends that aren't paramedics. And I say that with the utmost respect to all my colleagues who are paramedics. But I think it's important sometimes to have perspective from someone else's life who isn't doing the same kind of work you're doing, right? Yeah. So to be able to go out for dinner and nobody asks you a single question about how your day was, because that's great, because you don't want to talk about it.
It's already in your head all day.
Yeah,
12
totally
hours,
right. And even if you do answer them, they have no idea what you're talking about.
Yeah.
So that's great, because they don't ask any follow-up questions. So that's awesome. So unlike you're asking lots of follow-up questions. It's good. But I think that's also super important, is to be able to just disconnect a little bit sometimes, and those 4 days off that we have, I find it really important to try and disconnect for at least 2 or 3 of them.
So for those 4 days off, you're working out, just disconnecting, hanging out with people that...
Yep. Spending time with the boys, the young boys, and just doing other hobbies as well. So I do a little bit of research on the side, which whilst it's paramedic related is for me a little bit different. And so that helps me kind of disconnect a little bit from...
It's interesting to yourself, right? So it doesn't really feel like work at that point.
It's a hobby for sure.
Well, you must have worked with a handful, probably more than a handful of paramedics in your time. What are some common traits, if not just one trait, that all of them carry or seem to carry, in your opinion?
Well, I think it's pretty common knowledge that we think that most people who are in the emergency services, so police, fire and ambulance and the rescue associations, attract a lot of type A personalities. I think that's pretty fair to say. I think they all love having a really, really good laugh. But they all really like helping people as well. So I think they're the really common traits that I've certainly seen from Australia and BC. Like I keep saying it, but honestly, the people I work with are just an absolute laugh. It's just the
bromance.
Yeah,
right?
No, it's just good to come to work and everyone's in a good mood, and sometimes we're a bit grumpy when we've been worked a little bit too hard, but that's any job, but for the most part, working with these people is what makes your day at the end of the day, being a big cohesive team, all doing it together, because when you're working hard and there's lots of calls, everyone's working hard, so you just get the job done, which paramedics are just great at doing, and then go home, rest and come back for the next day. So
having my last podcast, I was talking about having a team, right? Having the right team can make all the difference.
Absolutely.
If you know your guys inside out and they know you and they know how you roll, absolutely. One day you might be grumpy and they might be like, you know what, that's okay.
Totally right.
Because the next day they could be grumpy, right?
Totally right. So it's being able to read the team. And that's a pretty important part of what we call crew resource management on these critical calls, is just being able to kind of know the strengths and weaknesses of your team and adapt the plan to kind of to make up for that and to try and achieve good outcomes. So.
Do you see a big difference in being a paramedic in BC and Australia? Like, what are the main differences in calls, if you can touch upon that?
I can. So I guess I get asked this question a lot, funnily enough, but by paramedics. Every time they find out or they hear me talking for the first time, they figure out I'm from Australia. They say to me, "You're obviously not from here," and I'm like, "Well, obviously I'm not. I've got a pretty thick accent." But then they say, "Well, what are the differences?" So I like to tell them all the exact same thing, because honestly, it's absolutely true. So the calls are the same. So people call an ambulance for the exact same thing. The patients are all the same. They all behave the same. They all present the same. The colleagues are all the same. They're hardworking, they're funny, and they're super compassionate. And we all face the same challenges from system to system. We think at night shifts we're a little bit overworked. We wish we had more sleep on station. But at the end of the day, the only difference that I can honestly think of between here and Australia is that we just drive bigger trucks here, mate. The ambulances are much bigger, and they're much cooler, I think, too. Got a lot more room in the back. We used to drive these Mercedes Sprinters in Australia, and I thought they were fine, but then I moved here and I just thought, geez, this ambulance has got 4 seats in the back plus a stretcher. I've just got too much room to move. So Now, whenever we're traveling to hospital, I just bring everyone in the back. So yeah.
Everyone hop in. So
Pretty much.
what did the sprinters have? Just two?
Just 2 seats in the back. Yeah, it was pretty cramped up in there. So
Yeah.
when there's lots going on in the back, there was not a lot of room to move. But I find that the back of these ambulances are like a little emergency department.
It's like a box kind of, right?
That's right,
in
yeah.
the back.
And they're deceivingly small, I think, from the outside because they're quite... I can stand up straight. I don't have to kneel. I mean, I'm a short guy, but, I can still stand up tall in the back.
You're actually quite tall. You're taller.
Very
Because
generous.
even he was saying, Ara was saying that you're taller, so we had to adjust the camera to make sure you're in the frame there.
Well, my seat was very high when I got here, so maybe you guys thought I was going to be
Give
pretty
credit
short.
to the chair?
Yeah, absolutely, yeah.
Well, give us 1, 2, 3 things. That's what I have written down here. 1 to 3 things, but you're more than welcome to give more or less. 1 to 3 things, more or less, things that you would change in the industry.
Well, tough question. All right, let's have a think.
I like how you take your time to think instead
No
of just
worries,
saying
yeah.
random things.
Just
Many
having
people
a
will
quick
just say
think.
things, right?
It's a tough question. So 3 things that I would like to change. I'm not entirely sure.
Should we jump back to this one?
Let's jump back to it. Absolutely. Yep.
So I noticed you're on Twitter,
I am.
and you're like one of the first paramedics I've seen on Twitter.
There's a lot of us on Twitter.
Yeah, then from you, I've noticed your other colleagues, I guess, that are also on Twitter.
Yep.
and
I
I'm
think
like,
they're
there
pretty
they are.
devastated they didn't get asked to come on this podcast. So I'm glad you found me first. One of them mentioned it today, actually. So
They were like, damn, right? Hopefully I get some more mics in the future and we can have your whole crew on here,
absolutely.
right?
Absolutely. There's a
be
big
pretty
international group, so you might have to start including subtitles as well if people can't understand what we're saying. So
cool. Fair enough. We'll actually do that. So you're on Twitter. How has technology impacted the industry?
Oh, massively.
Massively,
Absolutely,
I could see
massively.
that happening.
Yeah. I mean, innovation is driving paramedicine forward so much these days. When we're just looking at the technology that we had, 30, 40 years ago, I was actually just talking about it the other day, the first defibrillator. So the boxes that we carry around that we use to shock people when they're in cardiac arrest. The first one of those fit into the back of a truck, and that was it. The whole back of the truck was taken up by this
Holy
defibrillator.
crap. How long ago was that?
Well, I think it was. I'm guessing, but I want to say around the 50s, but I might be wrong if someone wants to correct me. But you look now, they released one the other day, it's a portable one. It doesn't have the full capability we use in ambulance, but it was about the size of an average sort of hand. And it's quite light, and those are the devices that we're using to save people. But if we really want to talk about some cool innovation that's happening, that's really saving lives, well, there's this app called PulsePoint, and for anyone listening, get on the App Store and download it. And it's an app where if there's a cardiac arrest, so a person who's unconscious and doesn't have a heartbeat and isn't breathing in a public place, that call comes through to 911. And as they dispatch an ambulance, if you've got this app on your phone and you're within a certain distance to that call, you'll be alerted so that you can go and provide CPR before the ambulance arrives. Because what we know from these calls is that despite all the fancy things that we have in the back of the ambulance that's going to try and save this life that's in cardiac arrest, actually the thing that will save them is basic care, so CPR and defibrillation. So if you've got this app and you're activated, I encourage you to go and help out. And look, they can be confronting calls, especially if you haven't done them before. So make sure you've had to think about if you really want to do it. But in terms of outcomes, we know that the people we save the most are the people who have really early CPR and really early defibrillation. And so we're using technology now to try and harness that public, all the public out there to try and help provide this, because sometimes the ambulance isn't close by for whatever reason. And so if we can get someone there doing CPR before we arrive, then that's fantastic. That's going to improve outcomes for sure.
That's a very neat app. That was PulsePoint, right?
PulsePoint, yeah, absolutely. And there's another app which isn't used too much in Canada, more so Australia and Europe. It's called GoodSam. And that's the same app, just a different company. So each like Canada uses PulsePoint typically, and that's also integrated into our dispatch system, so that when that 911 call goes through, the call gets pushed to the ambulance, the closest ambulance and the closest fire truck right away, and then at the same time goes out to the app. So you're getting notified as a public member of the public at the same time that the ambulance is.
So were you saying a lot of the public has PCP? They're just their basic primary.
So our primary care paramedics are the bulk of the workforce. So they'll be dispatched to those calls along with.
So if they have the app too, then.
Well, our paramedics typically get dispatched through our online system, but in terms of the public, anyone is able to download that app as long as they've got some CPR training.
Yeah, so. that's very smart actually.
Yeah, absolutely. And so this is the type of innovation that we're talking about that's really changed the face of pre-hospital medicine. In the past. There's a lot of really cool things that we could talk about too, but that's really medically focused. And I think if there's people out there listening, then I think this is a really relevant one for them to kind of have a look at downloading and using. Pretty
sure,
cool.
I'll definitely take a look. I already wrote it down here.
Perfect. Yep, get on there.
Well, I want to touch more base on like the overdose crisis that we're facing here in Vancouver. It's been in BC, in general, it's been like around over 1,300, I believe, days.
Yeah.
So what is the industry as a whole doing to prevent these overdoses? Any like new programs or anything they've implemented?
Yep. So I guess the first thing I'd look at is like some stats and general advice for these types of calls too, because I think a lot of people listening probably don't know a lot about what's kind of happening, and specifically in the downtown east side. Although overdoses and an opioid crisis can occur anywhere in BC, because we know it's just not limited to Vancouver, although that's where the bulk of the calls are. But the crisis, it affects people from all walks of life, and that's often interesting because you really can't tell who's susceptible and who's not. And this year, paramedics are due to respond to more calls than ever. So we think before the end of the year, we're going to do 24,000 overdose calls. Wow. And the large majority of those are going to be in Vancouver, but that's a real big increase because back in 2015 we were only doing about 12,000 calls, so we've almost seen that double in the last couple of years. And so on average, that equates to about 64 overdose calls a day within the province, which is a high call volume. And like I said, the large majority are here in the Lower Mainland. So I guess how can we reduce overdoses?
Are there any strategies being implemented right now?
Definitely lots. I guess what I would say is that the ambulance service typically is a very reactive healthcare force in that manner. Our job is really to attend these calls and try and resuscitate these patients. And luckily, when a patient suffers from an opioid overdose, we can give them a medication called Narcan, which is a reversal agent. The downside to Narcan is that it doesn't last as long as the illicit drug that they've taken. So what we usually advise when we wake people up is that they attend hospital. And when I say wake up, we're talking about patients where we arrive on scene and they've taken an overdose and they're unconscious and they're not breathing, but they still have a heartbeat in most cases because we catch them quite early. And so we've taken these people who are on the cusp of death. We resuscitate them by giving this medication and providing some oxygen, and we do that in conjunction with our fire department partners, who are often first on scene at these calls and do an amazing job. But even sometimes before them, we have healthcare staff in these areas which identify that patients are having an overdose and provide that care as well. So what we're doing now is issuing out these naloxone kits to the general public. And they can give them to anyone who they think is having an opioid overdose. So that's really good. But what we ask people to do is we say, look, if you're going to use, that's okay. We're not here to judge you. But we would hope that you would use a supervised injecting site, although we know you're not always going to do that. But that's really safe. And if you're not going to do that, well, consider using using these drugs with someone else. So there's just someone there if you do overdose and someone who can care for you, right? But often that doesn't happen, and an ambulance is called and we arrive, and that's totally cool. We'll treat you. We'll give you some advice and we'll try and help you out and link you in with some of the services in that area. Often, a lot of our patients, they just wake up and they want to go about their day, and that's okay. Our job is just to make sure that they are okay and that we're happy that they haven't suffered any significant or long-term effects. And then if the patient's able to make a decision about their own healthcare, then we certainly respect that. We don't force hospital rides on anyone if they don't want that, as long as they have the capacity. If they don't, then, and we're concerned about their health, then sometimes
You will take them.
Yeah, we can help them along to hospital. But look, 9 times out of 10 they come along. People are so polite, even after they've had an overdose, that they genuinely know that we're there to care for them. We haven't come because we want to harm them or do them a disservice. Like, we're generally there because we just want to help them out in their time of need. And over the years, paramedics have built a really good rapport with the public. I mean, we're continuously ranked as the most trusted profession, across the world, which is fantastic. And that speaks volumes to the way in which we're, talking and dealing with people in their time of need and their crisis, right? So I guess at a grassroots level, like I said, we're generally part of the immediate response. So our big thing is just helping them in that time of need, and then trying to link them in with some services in the area that we're in if they can. And then I guess from there, it's just about continuously forming positive relationships so that we're constantly welcome into these areas and we're able to help them as often as we can.
For sure. You don't want to be like pushed out, right? When
totally
you guys are
not, right? So we're really good at forming these positive relationships, and that comes by just being human when we're dealing with these patients and understanding that they have an addiction like anyone does, and they're just having a bad day.
I was going to ask you that, how the relationship is built with, there must be some like reoccurring patients that you see.
Of course, yeah. And I guess that's with any system in any type of call that we go to. But again, our job is just to provide the care to them at the time in a non-biased fashion. Just provide the best care that we can, and just make sure that we can try and link them in with appropriate health services if they can. But if not, and they refuse, and certainly if they're competent to do that, then we respect their wishes and let them go about their day for sure.
Yeah, not forcing anything. You're there to do your
absolutely
your duties.
That's always what we're just there to provide. The care the best care that we can to these patients. So get the right care to them at the right time.
Excuse me. So you have many years as a paramedic under your belt. Many more to come.
Many more to come, absolutely.
What are some tips you would give to anyone, let's say they're in the schooling stages, just trying to become a paramedic? Any tips that you would give to them after all these years?
What I would say, it sounds like a really odd thing, but I would say get into the job for the right reasons. And to be completely honest with you, when I decided I wanted to become a paramedic, as bad as this sounds, it wasn't really to help people. I don't think I was thinking that when I was 12 years old. It just looked really cool. And sometimes that's actually the problem, because if we view this job as just we're heroes every day, which we're certainly not, I think that leads to burnout for sure, because we have a really unrealistic expectation of what the job is going to be like. So I would say to anyone looking to get into the role, make sure it's for the right reasons. And I think that those right reasons are to provide healthcare to patients, because the face of ambulance is changing. The calls we were doing 20 years ago are not the calls we're doing today, and the community has different expectations on the ambulance service, which revolve a lot around community-based healthcare. All that general practitioner type call volume. And so if you think that you're going to come to work and do car accident and trauma and really cool job after really cool job, it's just not how the typical day goes. And so you need to really have a different shift and focus to get you through and get your long career out of you as well. So maybe
like kind of volunteer at some hospitals to kind of see what's
absolutely.
going on.
And even, I guess, if I'm just going to give any advice to anyone about doing any type of volunteering work before they come to ambulance, learning how to communicate with people is like the biggest thing that we do in this job. We can go a whole day without opening up our kit, and all we do is talk to people.
Yeah.
Often that's the absolute most important skill for any paramedic to have, and it's actually common in a lot of the emergency services jobs. And police is a great example. I mean, they just are expert communicators, and we need to develop those same skills too. So if you can do a volunteering type service where you get to talk to people on a daily basis, especially if they're a little bit stressed, or if you can try to help calm them, then for sure. And I know in a lot of the emergency departments here in the Lower Mainland, there's volunteers that sit in the triage waiting room, and their job is to kind of just provide advice to those people that are sitting in those waiting rooms. So that sounds like probably a good place to start, I'd say.
That's a great opportunity to communicate,
absolutely,
right?
Yeah.
With anyone and everyone. When I first started out in my job, it was all communicating. I think a lot of industries, you need to be a great communicator, even just as a person, right? You'll be able to talk to anyone in any situation, and it'll just help in the long run.
Absolutely. And look, I have days where I'm probably not an expert communicator, but look, I absolutely try my best to communicate appropriately at the time, and everyone's always trying to improve, I guess.
I feel like you've kind of already answered this question, but if you want to top anything off, like just one thing you want the public to know of paramedics.
Well, I think the biggest thing I'd love the public to know, and sometimes one of the most disappointing thing, is that, 20, 30 years ago, the ambulance service was literally a bunch of people who just, their job was to take you from your house or where the emergency occurred to the hospital. That was it. We were stretcher bearers.
Just the transportation.
Absolutely. But times have changed, and paramedics, and here in BC especially, have really professionalised over the years. I mean, we've got a good level of education, and we're continuously changing the way that we operate our service model. And so I guess the biggest thing I want the public to know is that, we're undergoing this big positive change, and our profession has evolved significantly, and we're now bringing more of the hospital into the home, which is not something that we were doing 20 years ago. And so the level of care that we're providing is really top notch. It's world class. And so I guess my hope for paramedicine in Canada is that the workforce continues to professionalise and gain that recognition as years go on. So yeah, that's my big thing for the public, I guess. So, and also, BC's got some amazing paramedics, so we want the people out there to know that as well, right?
For sure. Is the whole industry, is the industry as a whole retiring right now, or is it still young?
It's an absolute mixed bag. So we've got some really some older, experienced paramedics and some younger paramedics, and I think we need a really healthy balance. We can't have a workforce that's really, really young, because we lose all that knowledge base that we've got.
The
there.
mentorship.
Yeah,
that
the
you're
mentorship,
about.
right? So in BC, that's actually one of the key differences coming from Australia to Canada, was that we had a little bit more of an older workforce, but I think that's actually a really positive thing.
So in Australia, you had an older workforce, you were saying?
We had more of a younger workforce,
younger,
actually. Yeah,
younger,
much younger. I think the average age of the paramedic in Australia is under 30. Whereas here, I'd probably say it's a little bit over. But really, at the end of the day, I don't think it makes a huge difference. It's more about how the system supports the paramedics in developing themselves and feeling comfortable in their practice, which in both systems, I think they were doing a really good job, to be honest.
Oh, is there anything else you would like to touch base on? Just talk.
I'm just thinking. No, I'm not overly sure, I guess.
Do you want to jump back to that question? Things you would change in the industry?
Question. So 3 things I'd change in the industry. Sure. Okay. Let's have a think again. You know what I'd love to see here is self-regulation of paramedics. It's a bit of an odd one, but I've seen it happen in UK and Australia as well. And self-regulation, when any profession self-regulates, it's a really good marker that it's quite a mature profession. I think paramedicine in Canada as a whole is a very mature profession. There's a lot of research going on with paramedics in Canada, and we're constantly innovating and moving forward. And I think the next step in my hope would be that we gain self-regulation, so we get our own body and professional body. So yeah, that's what I'd love to see. What else? I guess the other thing I'd love to see too is a greater focus on alternate treatment pathways. And that seems like a bit of an odd one too, but we were talking before that the core volume 20 years ago to what it is now is really, really different. And so what we're seeing is that we really want to try and deliver the right care to the patient at the right time. And sometimes that doesn't mean that they have to go to the emergency department. And often it's a shame that we have to take patients to the emergency department because they don't want to go there. And so we're talking, if we give you an example, let's talk about palliative patients. So cancer patients in the end stages of their life, right? Where they may have had a hiccup with their treatment, but they don't want to go to hospital because they want to remain at home with their families. So, prior to, actually we've got a program going at the moment led by one of our fantastic paramedic practice leaders, Jenny. But prior to this program starting up, if you were a cancer patient in the last couple of months of your life and you had an issue, for example, let's say breakthrough pain, so atypical type pain that started or your pain's worsening and you just haven't gotten on top of it, and you called an ambulance, well, unfortunately, our only pathway was to transport you to hospital, right? But that has since changed, and so what we're now able to do is bring more of the hospital into the home, provide you with some different medications to help you with your pain, and then leave you at home as long as we feel that it's safe. And then we immediately refer and notify your regular health team at the hospital that we've come and seen you, and then they check up on you the next morning.
That's smart.
So that's one of the ways that we're kind of change things here in Canada and it's about providing alternate treatment pathways to our patients. And so that's one thing I'd really love to see expand. And I know that it's happening at the moment, but for me, that's really exciting. So yeah. There you go. So got a bit into the nitty gritty there of clinical practice, but I guess the key message there for people of BC is that that the face of ambulance is changing, and that we really are keen to deliver the right care at the right time to these patients. And so we're trying to find as many pathways as possible to be able to do that, and who knows where that's going to lead in the future.
That's good. I'm excited to see what happens in the future, right?
For sure, absolutely.
So much stuff's already changing, it feels like. After just having this short conversation with you, I want to talk about content right now.
For sure.
Content, just like how we're doing right now, video, audio. As a paramedic, are you allowed to, like, for example, have a GoPro on for your shift?
That's a touchy one. I don't know.
Yeah.
I don't know what's happening in Canada, but certainly in other parts of the world, they've started wearing body cameras for paramedic safety. The jury's out research-wise as to whether or not that actually prevents violence against paramedics, but it's one of the strategies they're looking at. But in terms of day-to-day GoPro on calls, there's just too many patient confidentiality issues for sure.
You have to blur out faces and
and it's
a
just
lot of information that will be seen, right?
Too difficult, yeah. Excuse me.
No worries.
Yeah, far too difficult.
Yeah, because that will literally bring out like everything of a paramedic, a day in the life of a paramedic.
It does, and one of the things that we're also so mindful of is that, we're going into people's houses in their absolute time of need, right? And so we want to be really mindful that we kind of are respectful of their environment and try and provide as much privacy to them as possible. But on the flip side, there was a show recently in BC where they followed paramedics around the province, and that was done really well, and they did a lot of editing, and they were able to kind of show the public a day or a night in the life of a paramedic. Really interesting insight,
just
right?
to see that. Do you know the name of the show?
I want to say, oh gosh, I'm trying to
probably
think.
Google it. Find
Paramedics Life on the Line, maybe.
There's some for policing. I think it's called Live PD.
Oh yeah, I've seen that.
Yeah, it's
and
in the States,
that's some next level stuff.
Yeah, it's some next level stuff.
There's I wonder how they edit things that are happening in real time on there, but
yeah, I don't think it's actually live. Like they could just be saying it's live. Or
bit of a delay.
I'm not sure how it is. Yeah.
Yep. It's called Paramedics Life on the Line on the Knowledge Network. That's the one. Yep.
Paramedics Life on the Line.
They just finished filming and they aired the whole series, and it's all following BC paramedics here in British Columbia, and I think mostly in the Vancouver region, just doing a bunch of calls, and you kind of just get to see the complete, two ends of the spectrum, the crazy calls that we do, and then the really serious critical calls as well. So it's a really interesting watch, and it follows all types of paramedics.
You'll have to link me to that
for sure,
or something. Yeah, I had no idea that even. I'll take a look at that.
Absolutely, for sure.
Hopefully we'll see you on it one day.
Oh no, I wasn't on this one. It was before my time. I've only been here a year, but there's many great paramedics on there. A lot of people that I work with that definitely, it was great for them to be able to showcase to their families what they do on a daily basis, because it's often so hard when we come home to try and explain what we did. Just words can't describe sometimes.
Yeah, and also like you were saying, you kind of want to disconnect, right? When you're off. Well, I don't even know how long we were just talking for there, but that was a good conversation. I learned a lot of new things about your industry. About yourself as well.
Oh, thanks very much, mate. Yeah, well, look, we really want to get the message out there to the public so they kind of know a little bit about what we do. It's a really great job, a really interesting job day to day. So
for sure, Twitter helps too. Just social media, being on there, being present.
Absolutely.
I feel like it's not too many people think a paramedic would have Twitter or social media.
No, we're on there for sure.
Yeah, but you guys are on there. I see you.
Professionalising our workforce. So we're definitely up there talking a lot about research and trying to make ambulance better and better every day, mate. That's what we're about. Well, I just want to thank you again for being on the podcast. Absolute pleasure. Thank you for having me. Hopefully in the future we can have your crew on here. Absolutely. I'm sure they'd love to come on, mate. So, yep. For sure. I'll get like 4 or 5 more mics and we'll get this set up. Absolutely. It'll be a very funny conversation. Probably it'll need a lot of editing. So, yep. For sure. Or maybe we can even blend it. Get some firefighters in here, police as well. And we can have a whole... we talk about all the crazy things that we do some days. That'll be awesome. Thanks, Tim. No worries. Absolute pleasure, mate. Thank you.